Okay. The Subcommittee for Indigenous Peoples of the United States will now come to order. The subcommittee is meeting today to hear testimony reviewing the Broken Promises Report, examining the chronic federal funding shortfalls in Indian country. Under Committee Rule 4F, any oral opening statements at hearings are limited to the chair and ranking minority member. This will allow us to hear more from our witnesses sooner and help members keep to their schedules. Therefore, I ask unanimous consent that all other members' opening statements be made part of the hearing record if they are submitted to the clerk by 5 p.m. today, or the close of the hearing, whichever comes first. Hearing no objection, so ordered. Good morning, and thank you to our witnesses for being here to testify. Today, we'll be examining a report released by the U.S. Commission on Civil Rights entitled Broken Promises, Continuing Federal Funding Shortfall for Native Americans. This report shines a bright light on what leaders and advocates from Indian country have been telling us for years, that the federal programs designed to support the social economic well-being of Native Americans are woefully and chronically underfunded. The federal government's trust responsibility charges us with supporting the general welfare of tribes, protecting their lands and resources, and promoting tribal self-government. The trust responsibility originally arose out of hundreds of treaties ratified by the U.S. in which we agreed to provide all proper care and protection to tribes in return for the seizure and occupation of their land. This responsibility is based on tribes' status as sovereign political entities with guaranteed rights. This responsibility is enshrined in statute, in jurisprudence, and in Article 2 of the U.S. Constitution. This responsibility is not being met. The programs we are examining today are not some sort of special treatment for tribes. These aren't handouts. They are a legal responsibility, solemnly agreed upon by both tribes and the federal government. The report we are looking at today isn't even the first time the federal government has received this wake-up call. The Broken Promises report was commissioned as an update to a 2003 report documenting huge unmet need in Indian country. The Broken Promises report confirms that little has changed and that the stakes of our failure are extraordinarily high. Native Americans continue to rank near at the bottom of all Americans in terms of health, education, and employment. They are victims of violent crimes at rates 2 times the national average. Native Americans have long experienced negative health disparities relative to other Americans, including lower life expectancy and higher rates of disease, depression, and suicide. Native American students have less access to educational opportunities, lack experienced teachers, and have the highest dropout rate of any racial or ethnic group. There are also huge gaps in affordable housing, modern infrastructure, and economic development opportunities. Chronic underfunding in Indian country also has less obvious consequences. Underfunding means staffing shortages at hospitals, schools, and agencies like the BIA, IHS, BIE, HUD, and DOJ. Less people to administer programs means longer wait times for funds to be released, and less accountability for those funds that are allocated. Simply put, underfunding these programs reduces their capacity to fulfill their core mission. The Broken Promises report is comprehensive in scope, but it boils down to one fundamental issue. The federal government must do more to live up to its responsibility. It is true that some of the programs have received small year-to-year increases, but rarely has funding kept up with inflation of population growth. The end result is that the actual funding for most of these programs has been decreasing steadily for decades. I want to thank the U.S. Commission on Civil Rights for their tireless work on this report and for providing us with a blueprint to change this shameful reality. I and this subcommittee are committed to working to changing this legacy of neglect and failure. Moving forward, I call on the administration and on Congress to have the fortitude and the political will to make these programs a priority and to provide adequate funding that will allow Indian country not only to survive, but to thrive. I would now like to recognize Ranking Member for any opening remarks.
Thank you, Mr. Chairman. This is a very, very difficult hearing. Many years ago, when I got out of the Marine Corps after 26 years working for the federal government, I went back to graduate school. You know, the oldest student in the class. I had a beanie. I was even old back then. But I went back to to get a degree in a master's in public administration. And part of the reason I got involved with local government, state government, and federal government was to try to answer some of these issues about the efficiency of government actions. And one of the pieces of legislation that I was really interested in was something many, many years ago, before some of you were even born. I think it was the Government Performance Results Act, where this problem of the government not delivering on its promises in a whole vast arena where they were supposed to, how we could do something about that. And of course, the classic example is why we're here today. How many treaties, how many lies, I can go on and on and on and on and on, hasn't delivered. And I don't think it's government bureaucrats just getting up every morning and say, yeah, I'm not going to help the tribe. I think this is a problem that has been around a long while, and in government inefficiency in how we solve that. I don't know if we can. By the way, the executive summary here, actually some great points and everything. But I don't know. At my age, I don't have time to read long, even executive summaries. I want the facts, real clear. Boom, 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 boom. If we don't do the following things immediately, within 3 weeks, you're fired or suspended or what have you. And it's like, and part of the problem is right here on this dais. We send to everybody, oh, we need a report on this, 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 and then we never read them, or we never do anything about it. So obviously I've had far too much coffee. I am venting right now, but this is a huge, huge problem. And as a historian, and I actually did get a degree. Ironically enough, and this shows you they ought to take my degree back, I was the outstanding graduate school for somebody like Paul Cook, whose IQ is the same as my football number, and that's 83. And it's been very, very, very frustrating in terms of veterans issues, in terms of the issues that many in the audience share, that we have not been able to move this bubble and crack the bureaucracy on all these things that have been promised and never delivered. And we're not talking 1 year, 5 years, 20 years. We can go all the way back to the first promise that was probably made at Plymouth or Jamestown or what have you. Certainly Jackson and, don't even get me going on that. So the challenges we have, I think this is a very good hearing. I don't know if we're going to solve it, but maybe we have to resurrect that Government Performance Results Act, because we're not doing it right now, and we're betraying the people that we made these promises to. That's all I have.
Thank you, Ranking Member. I don't know why you would be wearing a beanie in school, but you'll have to explain that to me later. Now I'd like to transition to our panel of witnesses for today. Let me remind the witnesses that under our committee rules, oral statements are limited to 5 minutes, but you may submit a longer statement for the record if you choose. When you begin, the lights on the witness table will turn green. After 4 minutes, the yellow light will come on. Your time will have expired when the red light comes on, and I will ask you please wrap up your statement. I will also allow the entire panel to testify before we question the witnesses. The chair now recognizes the Honorable Patricia Timmons Goodson, Vice Chair of the U.S. Commission on Civil Rights.
Chair Gallego, Chair Grijalva, Ranking Member Cook, and members, thank you for inviting me to testify. I am Patricia Timmons Goodson, Vice Chair of the United States Commission on Civil Rights, and I come before you today to speak about the Commission's work on evaluating the civil rights of Native Americans and implementation of the federal trust relationship, including our report released in December 2018, Broken Promises, Continuing Federal Funding Shortfall for Native Americans. The Commission's recent investigation, as approved by the Commission majority, reflects that the federal efforts during these past 15 years have resulted in only minor improvements, at best, for Native Americans as a group. In some areas, such as housing, conditions have actually worsened in that time span. Native American people continue to face everyday challenges due to disproportionately high rates of violence and crime victimization, poor physical and mental health conditions, high rates of suicide, aggregate low educational achievement and attainment, unemployment, and other challenges. More than 25% of Native Americans live in poverty. That's the highest poverty rate of any other racial group in the United States. The Commission received compelling and succinct distillation of this relationship and the need for congressional action during the 2016 briefing from Stacy Bowen, the Executive Director of the National Indian Board of Health, who testified, and I quote, "We exchanged 400 million plus acres of land and our way of life and our very lives for peace and for the provisions that are provided for in the treaties, and a basic human dignity of having basic services for American Indian and Alaska Native people," end of quote. Native Americans as a group suffer one of the nation's highest rates of crime victimization. For example, Department of Justice crime statistics show Native Americans are victims of violent crimes at a rate 2 times the national average. Native American women are 10 times more likely to be murdered and 4 times more likely to be sexually assaulted than the national average. The report documents life-threatening health and health access disparities. Chronically poor health conditions are compounded by poor levels of access to quality health care in Indian country. In addition to the health and criminal justice harms the report documents, the report reflects heartbreaking educational opportunity gaps, separating Native Americans' experiences in the nation's schools from their non-Native peers. Our report identifies major facility deficiencies in many schools in Indian country. Likewise, the Native American housing crisis has deteriorated from what was already a low point in 2003, when the Commission last reported on it. Poor physical infrastructure hallmarks the daily lives of many Native Americans. For example, an estimated 14% of households in Indian country have no access to electricity, 10 times higher than the national average. Instead of meeting these significant needs with systemically planned and sufficient funding, the years the Commission examined, the President's budget requests have been haphazard and generally, often widely insufficient. The lack of federal funding streams burden Native American communities in life and death ways. Here are key recommendations from our report. The United States should live up to its treaty obligations, just as the U.S. expects any other country. Congress should pass a spending package to fully address unmet needs. The federal government should provide steady, equitable, non-discretionary funding. To better understand whether the federal government is meeting its trust and statutory obligations, the Office of Management and Budget should develop more detailed standards for tracking. Native Americans bring a rich history, vibrant contributions, and to America's culture, values, and land. With great resilience, Native Americans have endured centuries of discrimination, injustice, and broken promises, and these harms continue today. The Commission calls on Congress to do better now because our fellow Americans are legally and morally entitled to fulfillment of the federal trust relationship. Thank you.
Thank you, Vice Chair. The Chair now recognizes Dr. Ana Maria Ortiz, Director of Natural Resources and Environment at the General Accountability Office.
Good morning. Chair Gallego, Ranking Member Ranking Member Cook, Chair Grijalva, members of the subcommittee. Thank you for having me here today. To acquire land and resources to develop this nation, the United States signed hundreds of treaties and agreements with tribes. In exchange for tribal claims to millions of acres, the federal government promised to protect and support tribes and Native Americans. The unique trust responsibility born of these commitments is embodied today in multiple federal agencies and programs that serve tribes and their members. In February 2017, GAO designated federal management of programs that serve tribes and their members as high risk because of weaknesses in 3 key areas: the Bureau of Indian Education, BIE, the Indian Health Service, IHS, and Indian Energy Resource Programs administered by the Bureau of Indian Affairs, BIA. GAO has identified resource constraints, such as staffing and funding limitations, and management weaknesses, such as poor oversight and inadequate planning, in programs and agencies that directly serve tribes and in processes designed to promote tribal government's ability to assume administration of federal programs. Resource constraints can include inadequate funding, limited capacity, and staffing shortfalls. For example, GAO reported in 2016 that a lack of staff, and more importantly, a lack of staff with the right skills, contributed to major shortcomings in BIA's process for permitting and reviewing tribal energy development projects. These shortcomings increased development costs, delayed projects, and cost lost revenues for tribes seeking to develop their own energy resources. In fact, one tribe estimates it lost $95 million in revenue due to BIA's inefficient process. Management weaknesses, such as in program oversight and inadequate planning, affect federal government delivery of services to and support for tribes and their members. In March 2016, we identified weaknesses in BIA's oversight that led to safety and health deficiencies at BIE school facilities, ultimately endangering students. Though BIA and BIE have taken some steps to improve the safety inspection process, as of November 2019, BIA still lacks a long-term capital asset plan to help it prioritize the repair and replacement of dilapidated BIE schools. GAO's work also highlights challenges and processes designed to support tribal government's ability to independently manage federal programs. For example, in January 2019, we reported that funding limitations may limit tribes' use of self-determination contracts and self-governance compacts. And in March 2019, we reported on barriers to effective federal agency consultation with tribes on infrastructure projects. Such challenges ultimately hinder tribal government's ability to deliver services to meet the needs of their citizens. I am pleased to report that since 2017, all 3 programs on GAO's high-risk list have taken steps to address some of GAO's recommendations for improvements, including in workforce planning and in oversight processes. To ensure additional progress, Congress and agencies must continue to tackle endemic resource constraints and management challenges in federal programs that serve tribes and their members. Addressing these challenges will support the sovereignty of tribal governments, including those that choose to administer their own federal programs, and will help to ensure that the federal government continues to prioritize its longstanding commitments to Native Americans. This concludes my oral statement. I welcome any questions you may have.
Thank you, Dr. Ortiz. The Chair now recognizes Rear Admiral Chris Buchanan, Deputy Director for Indian Health Services at the Department of Health and Human Services.
Good morning, Chairman Gallego, Ranking Member Cook, and members of the subcommittee. I am Chris Buchanan, Deputy Director for the Indian Health Service. Thank you for the opportunity to discuss the U.S. Commission on Civil Rights 2018 Broken Promises, Continuing Federal Funding Shortfall for Native Americans. IHS is committed to improving health care delivery and enhancing critical public health services to strengthen the health status of American Indians and Alaska Native people. Earlier this year, IHS released its strategic plan for fiscal year 2019 to 2023. The IHS strategic plan describes what the agency hopes to achieve over the next 5 years and aims to address challenges and build upon progress already made. The plan details how the IHS will achieve its mission through these 3 strategic goals. Goal 1, to ensure that comprehensive, culturally appropriate personal and public health services are available and accessible to American Indians and Alaska Native people. Goal 2, to promote excellence and quality through innovation of the Indian health system into optimally performing organization. Goal 3, to strengthen the IHS program management and operations. Through the IHS robust annual tribal budget consultation process, the tribal and urban Indian organization leaders have repeatedly and strongly recommended advanced appropriations for the IHS as an essential means for ensuring continued access to critical health care services. The IHS is eager to work with Congress on this issue. IHS continues to improve and increase access to care for its beneficiaries through outreach, education, and enrollment activities. The GAO's recent analysis of IHS data shows that from fiscal year 2013 through fiscal year 2018, the percent of patients at federally operated IHS hospitals and health centers that reported having health insurance coverage increased an average of 14 percentage points. This increased coverage and collections has allowed for an expansion of services provided off-site through the PRC program, allowed some patients to access care off-site using their coverage, and has reduced the need for some of the patients to access PRC. Since implementation of the PRC rates regulations in October of 2016, the PRC program has realized a $1.43 billion increase in purchasing power, according to the fiscal intermediary. This purchasing power has allowed PRC programs to pay for additional services and fund more medical priority levels than ever before, which improves access to care for our patients. IHS is moving forward to establish a national CHAP outside of Alaska to allow for this community-based, culturally responsive, and efficient model of healthcare to be expanded nationally. Through a national CHAP, IHS will provide a network of behavioral and community and dental health aides trained to support other health professionals while providing direct health care, health promotion, and disease prevention services. Significant improvements have been made in a variety of diabetes-related outcomes, including reduction by at least 1/2 in the rates of new cases of diabetes-related kidney failure and eye disease. In addition, hospitalizations for uncontrolled diabetes decreased by 84% between 2000 and 2016. The year of increases in the prevalence of diabetes and childhood obesity have stopped, and the rates for both have been stable for several years. The Special Diabetes Program for Indians has been a critical factor in making these improvements possible. Since 1959, the Indian Health Service Sanitation Facilities Construction Program has worked in partnership with tribal governments and other federal agencies to construct essential sanitation facilities, provide technical assistance that supports the operation and maintenance of those facilities. In fiscal year 2019, the IHS revised its internal guidance on how it collects sanitation deficiency data to further ensure that sanitation deficiency reporting follows the governing statutes, and resources used to address these deficiencies are allocated to projects on an equitable basis. As a result, it is anticipated that more funding will be allocated towards projects to serve homes that lack piped water supplies and waste disposal systems. We will continue to work closely with our tribal and urban Indian partners to transforming healthcare for American Indians and Alaska Natives across the country. We appreciate your efforts in helping us provide the best possible healthcare services to American Indians and Alaska Natives we serve. Thank you, and I'm happy to answer any questions.
Thank you, Rear Admiral. The chair now recognizes Mr. Jason Frihaji. Did I say that correct?
Frihagy.
Frihaji. apologize. Deputy Assistant Secretary for Management at the Bureau of Indian Affairs and Department of the Interior. Thank you.
Good afternoon, Chairman Gallego, Chairman Grijalva, Ranking Member Cook, and members of the subcommittee. My name is Jason Frage. I am the Deputy Assistant Secretary for Management in the Office of the Assistant Secretary for Indian Affairs at the Department of the Interior. Thank you for the opportunity to present testimony regarding the U.S. Commission on Civil Rights 2018 report entitled Broken Promises, Continuing Federal Funding Shortfall for Native Americans. Since Assistant Secretary Sweeney was confirmed, her goal has been to develop strong relationships with tribes to work on innovative solutions for lifting up tribal communities. The Broken Promises report documents the challenges facing Indian country. The report indicates it has been difficult for federal funding to keep up with these challenges, much less track with growth and annual inflation. While the challenges are significant, Indian Affairs is employing multiple strategies to advance progress. Within budget resources available, Indian Affairs is targeting funding to meet the highest priority needs and coordinating with federal partners to maximize investments. And recognizing that relying on additional appropriated funding is not the only solution, we have initiated several management and policy initiatives to address challenges identified in the report. Indian Affairs regularly engages with tribes in the development of the budget through the Tribal Interior Budget Council. TBIC provides a forum and process for tribes and federal officials to work together to set budget priorities. This engagement also includes discussion of policy issues and management trends. For example, at TBIC meetings, tribal leaders have repeatedly recommended advance appropriations for Indian Affairs to ensure continued delivery of programs during a government shutdown. Similarly, 105L lease authority is another emerging issue we are actively engaged with tribes on, and we welcome the opportunity to work with Congress to explore solutions. The President's 2020 budget for Indian Affairs is $2.8 billion. This includes total funding for BIA, BIE, and the Assistant Secretary's Office of Indian Affairs. One significant highlight of our 20 budget is a separate budget submissions for BIA and BIE as part of an effort to improve overall transparency, accountability, and autonomy of the BIE. BIE will retain existing programs and gradually assume direct responsibility for acquisition, safety, and facility management capabilities. The 20 budget includes $105.1 million for the Office of the Special Trustee and proposes to realign the line buyback program from the Office of the Assistant Secretary to OST. The land buyback program is responsible for the expenditure of the $1.9 billion Trust Land Consolidation Fund. It is important to note Interior's Indian Affairs funding is just one element of a broader set of federal investments in Indian country. Each year, the Office of Management and Budget develops a Native American budget crosscut for the federal government. The 2020 President's request for programs covered by the Native American crosscut included $21.6 billion across all agencies. We are also focusing on management and policy initiatives. Our education construction program has continued to make progress advancing critical school projects. We initiated a pilot program to comprehensively assess schools with the worst facility condition index scores. This process is transparent and data-driven and ensures timely information is available to keep construction projects moving as quickly as possible. Initial feedback collected from tribes on the process has been positive. Our Office of Justice Services seeks to uphold tribal sovereignty and customs while providing for the safety of Indian communities. In September 2018, Assistant Secretary Sweeney directed the deployment of additional Tribal Access Program information kiosks to address the backlog of background checks, which are necessary for covered individuals in a household when placing Native children in foster care. In partnership with the Department of Justice, the first kiosk to go live was on September 18, 2019 at BIA's Anadarko agency in Oklahoma. More deployments are planned in the coming months. The number of self-governance tribes continues to grow across Indian country. We are now up to 287 federally recognized tribes and obligations in excess of $15 million in FY 2019. Self-governance tribes currently represent 50% of all federally recognized tribes. Indian Affairs has employed many strategies to advance economic development across Indian country. In September 2019, the department hosted the landmark National Tribal Broadband Summit to explore ways to expand broadband capacity and investment. At the summit, a new $1.2 million grant opportunity for tribal broadband feasibility studies was announced. Indian Affairs is also focused on updating regulations that facilitate critical economic activity. For example, we announced proposed changes to the Tribal Energy Resource Agreements, or TERA regulations, which aim to remove hefty regulatory requirements and propose to establish an alternative to TERAs through a certification of Tribal Energy Development Organization. Over the last year, Assistant Secretary Sweeney has approved helping expedite and advance responsible tribal home ownership, or Hearth Act regulations for additional tribes, bringing the total number of tribes with Hearth Act regulations to 48. As the Broken Promises report demonstrates, much remains to be done to improve economic and social well-being of Native Americans. Indian Affairs is targeting resources available to address the challenge and achieving results which advance sovereignty and self-determination and increase the flow of investments into Indian country. Chairman Gallego, Chairman Grijalva, Ranking Member Cook, and members of the subcommittee, thank you for the opportunity to testify. I would be honored to answer any questions that you may have.
Thank you. I thank the witnesses for their testimonies, reminding the members of the committee that Rule 3D imposes a 5-minute limit on questions. The chairman will now recognize members for any questions that may wish to ask the witnesses. I will start by recognizing myself for 5 minutes. I'm going to mess it up again. Freyhaj? Freyhaj. Okay. Your testimony includes a lot of information about programs your agency has carried out. But what concerns me today is programs and projects that aren't happening. In the Broken Promises report, the Bureau itself estimated it funded only 21% of law enforcement and 3% of tribal courts needed in 2017, 3%. That's only in the area of public safety. According to the GAO, as of March 2019, half of all BIE positions had not been filled. How is it possible for your agency to fulfill its purpose in upholding our end of the special government-to-government relationship with less than half the resources necessary to meet the tribe's needs?
Within the budget process that we have, we do the best to target our resources to address staffing needs in law enforcement and elsewhere. In addition to planning budget within our budget targets, we also have been looking on the management side of ways that we can streamline our HR processes to improve the hiring process.
Okay, well, that sounds like a lot of budget speak, but I mean, we're only funding 3% of tribal courts in just 2017 alone. I don't even know what's happening right now. If we're going to try to fix this chronic problem, we do need some honesty and accountability from agencies that are carrying out these programs. For example, despite being short half a workforce in this year's budget request, the Bureau of Indian Education requested $144 million less than last year. Overall programs for Indian country were cut by $2 billion in the administration's budget requests. So I have 2 questions and a follow-up with that. First, what data is the administration using that would suggest we need to cut billions of dollars from Indian country, given that BIA estimates that we are only funding a fraction of tribal needs at this point?
Yeah, again, I think when in terms of budget planning, we work within the budget process to demonstrate how we can allocate funds as well as possible and use it for the best use. And within the president's budget process, we work for the best number that we can.
It just, if we're consistently, cutting short our commitment to Indian country for decades now, and then coming in with a budget that's, $2 billion short, we're never going to get out of this hole, and I hope you recognize that. Will you commit to taking the findings of this report into account in BIA's next budget requests?
Yes, as my testimony notes, we recognize the challenges that are identified within the report.
Okay. And so and I guess what I'm asking is I want a serious commitment that we're not going to see another budget request that's going to be underfunding Indian country by $2 billion and then being told that, we'll somehow make do.
Obviously, I can't commit to the final number that we would have in the president's upcoming budget request.
Right.
However, as noted, we've noted the findings of this report, and in Indian Affairs view, we always demonstrate whatever level we're at, we're trying to target the resources for the best use and demonstrate the value of the investments we can make.
Okay. Rear Admiral Buchanan, your agency has shortages and deficits that are just as startling. GAO found over 1,550 vacancies for healthcare positions at IHS, with 25% of clinical care provider positions still being vacant. How do staff shortages harm the service's ability to provide sufficient health care to Indian country?
Thank you for the question. The current vacancy rate as of August 2019 is 21% across the agency. We've been addressing our challenges with recruiting qualified healthcare providers and some innovative strategies going forward. We've been working through pipeline activities, Americans into Medicine program, the Nurses into Medicine program. We've also been partnering with our sister agencies. HRSA comes to mind as a opportunity for us to fill some of those hard to reach positions across the agency. Other activities that we've been utilizing is our scholarship programs, internships across. We partner with some of the hospitals around the country to bring those residents into Indian Health Service, to give them opportunities to see what it's like to work with Indian Health Service, work in those rural environments, with our hope that they would come back to work for us in the future. So several innovative strategies going forward. We're utilizing incentives in Title V and Title 38 to provide more funding for our providers so that we can be more competitive with the public sector.
Thank you. I now recognize Ranking Member Cook for questions.
Thank you very much. Unfortunately, I feel like I'm back in local government, and we're in the budget hearings, and here we have the battles over and over again. My problem, and it always has been, when I hear words on how we're going to do this, I'm always looking for results. You mentioned diabetes. The number of patients treated in a certain sample of certain tribes, how does it compare to the general population? Heart disease, Pseudomonas aeruginosa, Proteus mirabilis. I want measurable things so I can say, wait a minute, we got to correct that. That's instead, and I want action. I'm sorry, and I'm venting here. I've had too much coffee. I've been warned by the chairman, everything like that, and I need more treatment than anybody else. But the point is, I've been going through this for years. And I don't want this mamby-pamby response. This has been a problem for a long, long time. So I'm always asking for measurable results. If we have people dying, if we have women that are murdered on reservations, I want numbers and what has been the correction on this. That would be able to justify funding in certain areas where we can adjust that, instead of, you give me a lot of acronyms, and I'm terrible with acronyms, and I hate acronyms. And you give me 5 syllable words, I'm the dumb marine on the panel here. And so I'm always looking for the data. Years ago, I'd say, you give me the areas there, because then I can speak out or write accordingly on how we can correct that. And we can, but when we have these, well, things are getting better, and I don't want that. I want to see the point where there's zero diabetes, there's zero infectious disease, there's zero this and that. So I'm obviously venting, and can you, in a much more civilized manner than I have asked you, can you react to my comment or tirade? Anyone, whoever's wants to try it. I see the Admiral smiling. You got it. You're in the military.
Well, would like to try to answer your question for sure. One of the items that we identified in our testimony was the special diabetes program for Indians. I think one of the key items that we identified or highlighted was a 54% reduction in end-stage renal disease over a specific time period, which is almost unheard of. And what we can link that back to is the special diabetes program for Indians. That's just one example that I could throw out there. I also recall that you mentioned the Government Performance Results Act that we at Indian Health Service utilize on a regular basis. Having been a former CEO at hospitals and clinics, we have performance indicators that we use to monitor our progress as it relates to vaccinations, domestic violence prevention, diabetes, A1C counts. So all of our facilities have those performance indicators, and we review those, provide oversight to make sure we're making progress.
I'm not interrupted, but I think the military the last few years have been acceptable because they've been, or they've done much better in the budgeting because they brought up their readiness ratings. Now, well, when you use a lot of general words, if it's an acceptable rating, whether it's healthcare, education, or what have you, and it's like not acceptable or superlative, then I think at least it gives us, hey, there's something being done here with this particular tribe. What is the success story that we can perhaps carry on to the other tribes? Dr. Ortiz, can you kind of respond?
I think your question highlights one of the themes that comes up in many of our GAO reports, which is that data are lacking. And one of the strides IHS has made is addressing some of that data, which will help it to do that monitoring to demonstrate progress. For example, in the Sanitary Construction Facilities Program, GAO had reported that there were errors in the data where you couldn't distinguish between whether or not a house or facility had been assessed or whether or not it was severely deficient in terms of sanitation. And IHS has taken steps to remedy that. We'd like to see that progress at other agencies.
Yeah, they're giving me the hook here. The only thing I'm saying is, yeah, but if I'm a tribe and I don't have a sewer, that's all I know. I don't care about the data. Fix the sewer, fix the diabetes, fix the education. Sorry, I'll yield back.
I'll come back to you. Yeah, well. Now we have Representative Holland for 5 minutes.
Thank you very much, Chairman. I would like to submit a brief statement for the record. Basically, it's just a list of thank yous for this hearing. Thank you, Ranking Member Cook, Colonel Cook, for your unwavering support of Indian country, and of course, Chairman Grijalva. So I will submit that for the record. My first question is for Dr. Ortiz. Aside from the high-risk list that you mentioned, what other topics does the GAO believe are critical to examine?
We've examined a broad range of programs over time, and I think 3 areas that are ripe for future research are economic development, infrastructure needs, and tribal justice. Economic development is critical because it allows tribes to generate revenue, which helps them to improve service delivery to their members. And it also provides opportunities for individuals. That, in the end, has better outcomes. Infrastructure supports that development. We've done work on broadband access and transportation. Without adequate infrastructure, it's difficult or impossible to engage in the kinds of development activities you need to make progress. And finally, with respect to tribal justice, GAO's work in human trafficking in Indian country and Native youth delinquency has illustrated some problems with the tribal justice systems, and particularly the way the federal government, the state governments, and tribal law enforcement agencies interact. These problems have been exacerbated by an opaque and overlapping jurisdictional maze when it comes to specific crimes.
Yes.
We expect that our work on missing and murdered Indigenous women that we're starting up within the next month will also illustrate some other problems in tribal justice.
Thank you. Thank you so much. My second question for you, Dr. Ortiz, why is GAO's high-risk designation focused on education, healthcare, and energy development, and what other issues need attention?
Our high-risk list agencies and programs meet specific criteria, both qualitative and quantitative, having to do with, for example, health and safety, effective program delivery, and large financial implications. But more importantly, it's because there are many open GAO weaknesses and systemic management challenges at these problems. The agencies may lack a leadership commitment to fixing challenges, or they don't appear to have demonstrated an interest in figuring out the root causes of the problems. We've done other work on, as I've said, tribal justice, infrastructure, looting and trafficking of cultural items, self-governance, and tribal consultation. And these are all important areas as well. But the high-risk list in particular is where we see grave and urgent need.
Thank you. Patricia, Ms. Timmons-Goodson, what are some non-funding based recommendations you have to improve the U.S. government's promotion of self-governance and sovereignty of Native Americans?
Thank you very much for that question. The first response that I would give goes back to Ranking Member Cook's assertion about the need for measurable results. I think he's put his finger on it. One of the biggest impediments to the government keeping its promises is a lack of data. And so that would be an effort that could be made that would not require a whole lot of money. We're talking about getting a handle on measuring the issues, the needs that are present in Indian country, and the response or the lack of response to those needs.
Thank you. And my last question in 30 seconds or less, Mr. Fryhaji, the Broken Promises report noted that there are issues with coordination between DOJ and BIA, especially in law enforcement and tribal criminal justice programs. What is the BIA doing to ensure the line of communication and coordination processes are in sync with each other?
I'd say the highlight of it, which is emblematic of the personal relationship and taking advantage of technology, is our effort in the Tribal Access Program, Kiosks. This is where we work closely with DOJ so that we could deploy kiosks which allow for quick background checks in Indian country, which is important for placing children, Native children in foster care. But similarly, it can also help with keeping firearms away from persons who are disqualified and receiving them, improve safety of public housing, and allow tribes to enter arrests and convictions into national databases. This tool provides the kind of the linkage that really allows us to have the information flow more easily across our departments and throughout Indian country.
I yield, Chairman.
Thank you. And for our committee members, we can do a second round of questions, so you don't have to rush through your questions. I now recognize Representative Case. 5 minutes.
Thank you, Chair. First of all, I certainly endorse the concerns of all of my colleagues up here on both sides of the aisle with the general questions being asked at this hearing. My particular focus, being from Hawaii, is on the indigenous peoples of Hawaii, Native Hawaiians, who, although they do not have the same, treaty-related relationship with the United States, certainly have seen the same consequences in areas of education, healthcare, business opportunity, and fundamentally have sought the same relationship. And I appreciate the Commission's recognition of that and a recommendation of that in its report. We have about 600,000 Native Hawaiians at this point across our country, 300,000 in Hawaii, so 300,000 elsewhere in our country. And this is a major issue for us, of course, in Hawaii, but throughout our country, is to treat Native Hawaiians fairly as well. Ms. Timmons-Goodson, I'm going back to the report. One of the recommendations of the Commission had to do with data, just basic quality of data. And specifically disaggregation of data. For example, Native Hawaiians are lumped together with other Pacific Islanders. Now, Native Hawaiians have many things that they share with other Pacific Islanders, but they have very different characteristics from one Pacific Island group to the other. So it's hard to target in on Native Hawaiian issues, and I suspect this is the case also with other indigenous peoples. Can you comment a little bit more on what we need to do to be sure we have high-quality data when we're actually having these discussions and formulating very targeted, specific solutions to include funding?
Thank you. You have put your finger on what is absolutely necessary, and that's the deaggregation of the information. And I believe that we know how to collect data. All we need is the will to target where it is that we're going to seek the data. And that is what we would need to do with the Hawaiian as well as the American Indian population.
So are there specific areas that the commission identified that where the lack of sufficient disaggregation does in fact create confusion as to very specific, as the ranking member noted, qualitative, quantitative data on targeted programs and impact on very specific populations? Are there areas, for example, are we less clear in housing, for example, or healthcare, if we don't disaggregate down to a sufficient level of detail? Are there areas that we especially need to be worried about the kind of data that we're trying to evaluate these decisions from?
Well, I believe that it would be easier for us to collect the data in particular or on particular subjects and areas. And so housing and income may certainly be easier to collect than healthcare statistics. And so depending upon the particular population that we're viewing, each presents its own challenges.
Okay, thank you. Did any of the other witnesses have comments on basic data quality that we're making some pretty important decisions on, including sufficient disaggregation? Anybody else have thoughts on that? Are there gaps? That's really what I'm after. Where do the gaps? We know that it's not sufficiently disaggregated. Certainly not disaggregated sufficiently with respect to Native Hawaiians. I assume that may be the case with other indigenous peoples. So I'm just asking, for example, on a healthcare perspective, are you confused about exactly where you need to send your money and your focus because you don't have data down to a sufficient level of detail?
You know, one of the, as we were talking and as the discussion was happening, it kind of drew me back to a discussion, a roundtable that we had recently in Rapid City, South Dakota, and it was focused on missing and murdered indigenous women. And everybody around the table realized that there's a problem, but nobody really realized how big a problem it was, or that there was any data to back that up. And as I was sitting there talking to a tribal leader, it just seems like we could ask that question as those patients enter our system, and then we could start tracking that data. And just yesterday, having a discussion with our chief medical officer, we're looking at implementing some ICD-9 codes that will crosswalk. There's some computer programming that needs to be done, some magic that happens there that I'm not an IT specialist, but it's doable. And I think it's just us asking those questions and how we can implement those into our processes so that we can collect the data and address some of these significant issues. So,
Okay. Thanks. And, I'm sorry, yes.
And I'd just add, similarly on the missing and murdered women topic, sometimes it's administrative data, looking across our departments, how we do that. Indian Affairs has been engaging with DOJ and others to look into cold cases to see if we can find progress on the cases that have been around for a while. I'd also like to note where we've made some progress in the school construction area this past year of 2019. This was the first year that the Bureau of Indian Education completed all of their safety inspections and completed abatement plans related to those safety inspections, all 100% on time. And that's going to help us target more directly projects that we need to get the schools in a better shape sooner.
Thank you.
Now recognize Ranking Member Cook.
Just comment on your last comment. You know, I understand the safety is very, very important. I'm interested in graduation rates, in dropout rates. All these things are going to make a difference in that community. We want them to do better, and I understand safety and the whole works. But that's the crux of the matter, at least as far as I'm concerned a little bit. So.
Now I recognize Chairman Grijalva.
Thank you very much, Mr. Chairman. Thank you for the hearing. Madam Vice Chair Timmons-Goodson, in your testimony, you note that the President's budget request is one key piece to dealing with funding, and in this case, underfunding of Indian country. Let me just go a little further. Would you say that agency implementation is also another key to the lack of programming in Indian country? And, you know, one of the things that we've been talking about, if I may, Dr. Ortiz, and everyone on the dais has made it, and the points being made by all of you, is the data collection, the quality of that data, and how that data would guide the programming and the implementation and the prioritization, on and on and on. And do you think that and we need it, that's not the argument. One of the questions I have is, don't we need a better integrated system from agency to agency, department to department, when it comes to Indian country, so that the Department of Justice is not doing its own thing, so that we're not transferring funds to states without knowing how and when, that we're not, that even agencies within Interior, that all those different funding sources basically being their own silos and not being integrated into one. Does data collection going to lead us to that end, or is that a parallel thing we should be working on?
I believe that data collection is one of the critical factors, because without accurate and comprehensive data, you cannot measure progress and you cannot target resources effectively. For example, we've reported that IHS doesn't have centralized data with respect to the temporary contracted care that they use to help fill some of these vacancies. And without that centralized data, you can't come up with an action plan on where you really should be targeting those resources to make sure you recruit and retain people in a site, which is cheaper than paying for contracted care in another site.
But, Mr. Deputy Secretary, but the fundamental question remains, and following up on Dr. Ortiz, that at the end of the day, we're talking about additional resources that are going to be needed regardless. The data will help target, plan for, integrate the effort, give more status and profile to the needs that tribes have, but at the end of the day, it's more resources. Like BIA school construction. Is there a list of the schools in need of new or improved facility that is public and transparent? And if so, how often is this list updated? Just, that's one particular question.
Yeah, so in terms of the list, we are close. We finished 11 of the 14 school construction projects from the 2004 list. We're making good progress on 2016. So the ones that are public right now is we're expecting to finish our Little Singer School here in calendar year 2019. In 2020, Beatrice Rafferty, Quileute, Blackwater, Laguna, the DZ School we expect to finish. And in 2021, Cove Day and Lukachukai are on track for those. So that's our immediate ones that we're working on now. More recently, noted in the testimony, we've also started a new site assessment pilot for assessing all the schools that are in poor condition, which is roughly about 6 schools. We've started working with assessing the first 5 schools, and we've been working with tribes on that. We've done listening sessions on this process at both the NCAI national meeting and recently at TIBIC. So we are trying to increase the transparency of this effort. It's very data-driven, and so I think it'll be a step forward in us moving toward the long-term capital asset plan that GAO would like us to achieve.
Representative Grijalva.
Yeah, please.
I understood your question to be whether there was a difference in data collection and coordination among and between the various agencies. And I very definitely think that there is a difference, and that the agencies do need to work harder, according to our report, at coordinating with the various federal agencies, that it is through that coordination and that consultation with the Native American communities that is critical to vital decision-making. So there's definitely a difference, and both of those courses should be pursued.
Thank you. Yield back, sir.
Thank you, Mr. Chairman. Now I recognize Representative Holland.
Thank you, Chairman. I just have a few more questions. For Vice Chair Timmons Goodson, what can Congress do to ensure that the U.S. government fulfills its obligations to Native Americans? I know you've spoken of this in your testimony, but I wanted to give you an opportunity to just say whatever else you felt you needed to say about this.
I believe that the greatest thing that must be done is an acknowledgement that there is a responsibility there and a will to carry out and to carry through on the commitments and the obligations. Without a will to do it, to go forward, I think that that is why we find ourselves where we are today in terms of perhaps half-hearted, poorly coordinated efforts. And so we should first acknowledge the obligation that we have and go forward from there.
Thank you so much, and thank you so much for your leadership on this issue. I appreciate it very, very much. This is for Rear Admiral Buchanan. You mentioned that the CHAP program and the impact it has had on rural Alaska. As you know, there are numerous other tribes with rural and health issues. In fact, the majority of tribes. How is IHS working to implement the CHAP program in the lower 48?
Thank you, ma'am, for the question. We've learned a lot from the Alaska CHAP program. I believe they've been in operation since mid-19 to late 1960s. When the issue has come up related to CHAP, it seemed like that we could just adopt what they had and implement it in the lower 48. And in my mind, I thought we could do that in weeks, but it's been since 2016, I believe late 2016, that we've started down this road. We've been working closely with our tribal partners, learning some best practices. We're currently in the, as I call it, the stretch run, where we'll be able to roll those activities out. We've, again, had CHAP work groups where we've been meeting regularly to develop those best practices. Not only will we be able to do CHAPs for behavioral health, we'll also be able to do the dental health aid programs and the community health programs. So we're really excited about that. It gives us another mid-level type provider for our agencies and for tribes to utilize across the country so that they can reach out in some of those hard to reach areas. Recently was in Alaska. I got to experience CHAP firsthand. Was in one of the remote villages and happened to be just sitting there in the getting a tour of the small clinic, and a CHAP aide came by, and elderly lady walked into the office and complained of chest pains, and they took her back to the exam room, and telemedicine video popped up on the screen. A person from Anchorage, Alaska was able to render aid to that elderly lady at that time. So it's a proven technology. It's something that IHS wants to copy and improve, and we can't do it alone. We need the assistance of the tribes, members of Congress, our tribal and our federal partners to make it a success. So thank you for the question.
Thank you so much. Chairman, I yield. Thank you.
Excellent. Thank you to our panel witnesses. I will now invite panel 2 to take their place at the table.
There's only two, so this is the second panel.
Bless you, bless you, bless you.
Oh, that one is just left over.
Did you want to hear them first and then go, or do you want to make your opening statement and then go?
Yeah, there's just two
I already gave my opening statement.
Like, I didn't do the rest.
Oh, that's right. I guess we do another one. Yeah. Yeah.
Oh, okay, yeah.
Why, you want to hear it
Yeah,
again?
no, there's only two.
No. If,
You're gonna give me a hard
if I, I'll call my grandpa if I want
I
some
didn't pay
ramblings.
attention to- I can make up another one.
So whenever,
I believe you, sir.
yeah, it's
How many panels you got today? 4?
No, we got 3. I wouldn't do that to you, buddy. That's right.
hide under So if you could please ask them the MAHB questions, that'd be great. Yes, and I have a bunch more questions that I'm gonna submit for the record, so.
And that's the only question I have.
No, you have another set. I don't know what the questions were.
As with the first panel, oral statements are limited to 5 minutes, but your entire statement will be part of the hearing record. When you begin, the lights on the witness table will turn green. After 4 minutes, the yellow light will come on. Your time will expire when the red light comes on, and I will ask you to please wrap up your statement. I will also allow the entire panel to testify before we begin questions. The chair now recognizes the Honorable Fawn Sharp, President of the National Congress of American Indians.
Hawishka. Good morning, Chairman Gallego, Chairman Grijalva, and Ranking Member Cook, and members of the subcommittee. On behalf of the National Congress of American Indians, I'd like to thank you for holding this hearing today to discuss the Broken Promises Report. I would also like to thank Representative Derek Kilmer and all the other members who signed the letter to the U.S. Commission on Civil Rights requesting the development of this report. I am Fawn Sharp, President of the Quinault Indian Nation and the newly elected President of the National Congress of American Indians. I look forward to working with the members of this committee and members of Congress to ensure the federal government finally meets its treaty and trust obligations to tribal nations. Indian country seeks only those things promised to us by the solemn treaties and agreements reached between tribal nations and the United States. When tribal nations ceded millions of acres of land to the United States, the federal government promised to safeguard tribal nations' sovereign right to self-determination and to provide tribal nations adequate resources to deliver essential services effectively. The U.S. Commission on Civil Rights Broken Promises report emphasizes that tribal nations, what we've known for a very long time, that federal funding levels and support for tribal sovereignty and self-determination fall well short of meeting the federal government's treaty and trust obligations. This report is a status check on the federal government's progress in meeting its obligations and can only be viewed as an immediate and urgent call to action. The federal government has a long way to go in living up to the promises it made to Indian country, and there is no doubt that fully meeting its treaty and trust obligations will not happen overnight. However, I want to share some recommendations on how our trustee can take immediate steps to begin making good on its promises. Congress and the administration should start by giving serious consideration to the recommendations in the report as they negotiate funding levels in the coming weeks. The Broken Promises report speaks at length to the shortfalls in federal funding and the negative impacts they perpetuate in tribal communities. There is no time like the present to make significant increased investments to support public safety, healthcare, education, housing, and economic development in Indian country. In addition to sufficiently funding our programs, Indian country needs certainty in the federal budget process. For the second time this fiscal year, Congress is passing a continuing resolution to avoid a government shutdown. This lack of continuity in federal funding negatively affects health care provided to IHS and public safety, emergency management, and other services provided by the BIA. As such, I call on members of Congress to stand with Indian country by supporting and working to enact legislation that would authorize advanced appropriations for IHS and BIA. The federal government must also establish policy that supports sovereign and self-determined decision-making at the tribal level. Accordingly, Congress must permanently reauthorize the Special Diabetes Program for Indians to improve health outcomes in tribal communities, immediately reauthorize NAHASDA to help address the housing crisis in Indian country, and pass a VAWA reauthorization that offers Native children, victims of sexual assault, trafficking, and stalking, and tribal officers the same protections that VAWA 2013 provided for domestic violence victims. Given the federal government's long neglect of its treaty and trust obligations, making good on its promises will require the federal government to be intentional and strategic in its efforts. The decisions made by this body and across the administration have long-lasting impacts on the lives of those residing in tribal communities. To advance the federal government's efforts to finally make good on its promises, I challenge each member of Congress and every federal official here today to walk away from this hearing with a renewed commitment to Indian country and a renewed commitment to educating your colleagues about the United States' obligation to American Indians and Alaska Natives. Prosperous tribal communities can only become strong, self-determined tribal nations until the federal government establishes policy that recognizes the proper place of tribal nations in the American family of governments. American Indians and Alaska Natives will continue to face many of the challenges highlighted in the Broken Promises report. Thank you for the opportunity to testify. I am happy to answer any questions you may have. Siokwil.
Thank you. The chair now recognizes the Honorable Lynn Malerba, Secretary of the United South and East Tribe Sovereignty Protection Fund.
Chairman Gallego, Chair Grijalva, Ranking Member Cook, and other members of the subcommittee. Katop Tonta Mawish, thank you for holding this hearing and the opportunity to provide testimony. Natiwi Sunksquamatai Mutahash, my name is Chief Many Hearts Lynn Malerba of the Mohegan Tribe, Secretary for the USET Sovereignty Protection Fund. We are here today because the federal government is failing to deliver upon its obligations to tribal nations and Native people. This failure has persisted despite changes in administration or Congress, despite numerous reports, investigations, recommendations, and consistent advocacy from Indian country. In 2003, the U.S. Commission on Civil Rights issued the Quiet Crisis Report, which found that measured by honor of funding commitments, none of the agencies reviewed met its obligation to tribal nations. In 2003, this body and the administration had that information and the opportunity to reverse course. Yet, 15 years later, the Broken Promises Report issued by the Commission found that the funding of the federal trust responsibility and obligations remains grossly inadequate and a barely perceptible and decreasing percentage of agency budgets. By some measures, since 2003, the U.S. has lost ground in fulfillment of its obligations and the promotion of tribal sovereignty and self-determination. This is not a question about addressing poverty and needs across Indian country. Our relationship with the United States is ultimately about honor, fulfilling commitments and promises. When will the United States begin to truly pay its debt to tribal nations owed in perpetuity for the extensive lands and resources ceded by our ancestors? A great nation keeps its word. Beginning today, America must begin to fulfill its promises by taking action. Since the release of Broken Promises, USET SPF has been calling for swift action to address its findings and recommendations. We urge all branches of the federal government to ensure that we are not having the same conversation about these shameful failures ever again. Deep and chronic failures require bold systemic changes. The solutions we offer involve a fundamental shift in federal Indian policy and funding. They will allow Indian country to realize its great potential and create lasting positive change for our tribal nations and people. It is critical that the administration propose and Congress demand budgets containing full funding for all federal Indian agencies and programs. Given our history and unique relationship, this funding can no longer be subject to the instability of discretionary spending, but must be mandatory funding. Federal funding and services provided to Indian country are the result of trust and treaty obligations, which are not discretionary. Additionally, grant funding does not reflect the trust obligation or our sovereignty. It treats us as not-for-profits rather than governments. ISDIA contracting and compacting must be an available option across the federal system. The processes under which OMB develops budgets and policies that impact us require reform. We believe a strong tribal affairs office should be created at OMB. In concert with this office, OMB must be required to produce a full, detailed accounting of the funding distributed to Indian country, including only what tribal nations access, not funds for which we are technically eligible. As are other agencies within the federal government, OMB must be subject to consultation requirements. Similarly, consultation should be reformed across the federal government to provide a meaningful standard for engaging tribal nations in decision-making. Providing the opportunity for tribal nations to offer guidance and then failing to honor that guidance is not consultation. In the short term, tribal consultation should be required via statute, which strengthens the existing executive order. In the long term, we must return to tribal nation consent for federal actions as a recognition of sovereign equality. Next, the federal government must prioritize the restoration of tribal homelands, which are fundamental to our existence as sovereigns and our ability to thrive as healthy, self-sufficient communities. This includes the acquisition and legal defense of trust lands and a return to parity into the land into trust process through the passage of a Carcieri fix. Despite our inherent sovereignty, tribal nations are barred from prosecuting many non-native offenders due to gaps in criminal jurisdiction. And when the federal government fails in its obligations, criminals are free to offend with impunity. This gap is compounded for some nations in our region who are subject to settlement acts that states argue prevent the application of laws like VAWA and TLOA. USET SBF urges the restoration of full criminal jurisdiction on our lands, including through a full Oliphant fix. We further urge the confirmation that laws intended for all tribal nations apply to all tribal nations. Lastly, the United States must invest in the rebuilding of tribal nation infrastructure and economies. Similar to the U.S. investment in the rebuilding of post-World War II Europe, via the Marshall Plan, the legislative and executive branches should commit to the same investment to rebuild tribal nations, given that our current circumstances are directly attributable to the acts and policies of the United States. This includes investments in physical infrastructure as well as the promotion of healthy tribal economies through parity in the tax code and certainly in certainty in tax jurisdiction. In closing, it is time for a comprehensive overhaul of the trust relationship and obligations, one that results in promises kept to tribal nations. USET SBF reiterates its call for swift action to address the findings of the Broken Promises report. We commend current legislative efforts to bring about the change and urge that any resulting bill includes the bold proposals required for lasting impact. Thank you, Katapton Tamawish. I am happy to answer any questions you may have.
Thank you, Chief. The chairman now recognizes the Honorable Jonadadev Chaudhry, Ambassador to the Muscogee Creek Nation. And again, I apologize if I said that incorrectly.
Chairman Gallego, Ranking Member Cook, Chairman Grijalva, and members of the committee, good morning. Hicks Chief. My name is Jonadadev Osceola Chowdhury, and I'm honored to serve as Ambassador of the... Should I start over? My name is Jonadadev Osceola Chowdhury, and I'm honored to serve as Ambassador for the Muscogee Creek Nation. As the signatory to a number of the treaties referenced in the Broken Promise report, the Muscogee Creek Nation maintains a profound understanding of how the United States' failure to abide by its promises has impacted all tribal nations and their citizens. At Creek Nation, our story begins long before the United States. One of the first things President George Washington did after the United States became a nation was to sign a treaty with the Creek Nation. To do so, he negotiated with the head of the Muscogee delegation, a leader of our ceremonial Hickory ground. The Treaty of New York, signed in 1790, a scant year after the adoption of the U.S. Constitution, was the first of several treaties our nation entered into with the fledgling United States. Although an element of coercion and duress factored into our nation's signing onto all of the treaties that we signed onto, the promises made by the United States within those treaties must be upheld. Our treaties with the United States have guaranteed Creek Nation its reservation, jurisdiction, and inherent right to self-govern. I am the son of the late Gene Hill Chowdhury, a full-blooded Muscogee Creek, born on our family's allotted land in Okfuskee, Oklahoma County. My mother was raised in the household of James Scott, a man who, as a young boy, survived the Trail of Tears. Many Creeks, including myself, were only 3 generations away from our removal on the Trail of Tears. Thus, the impact of broken promises constitutes a very real and present fact of modern Muscogee life. Today, the Creek Nation is the 4th largest tribe in the United States, with our headquarters in Muscogee, Oklahoma. And although Creek Nation has made significant gains in its economic development in recent years, much more is needed to begin to repair the United States' broken promises. My written testimony goes into greater detail, but here are a few examples of what I think the Broken Promises report has highlighted that are directly relevant to Muscogee Creek Nation's needs. First, reauthorization of the Violence Against Women Act. After the House passed H.R. 1585 this past April, VAWA has stalled in the Senate. I urge you to reach out to your colleagues, regardless of what side of the aisle you're on, and ask them to support the passage of 1585 now. Restoring tribal sovereignty and protecting Native women is not a partisan issue. Instead, it is a promise, one that should not be broken. Second, our veterans. One area the report largely admitted but should be addressed are the special challenges that Native veterans face. When the government lets down Native veterans and fails to deliver on what has been promised, it is in effect a double broken promise, as the U.S. government has failed in their duties to protect Indians, both in regard to the United States trust responsibility and with regard to tribal members who have served this nation honorably. Third, maintaining treaty-created reservations. The Muscogee Creek Nation Reservation that exists today was created in a treaty our nation signed with the United States in 1866. The reservation guaranteed by the Treaty of 1866 constitutes a promise to my people that our lands would be, quote, forever set apart as a home for said Creek Nation, end quote. This promise, made by the United States, was effectively an exchange for the cessation of our original homelands, an exchange that was ruthlessly effectuated by our forcible removal on what we all know as the Trail of Tears. Fourth, sacred sites. Today, the home of the Hickory Grounds leader who negotiated the Treaty of New York, which helped establish the sovereignty and legitimacy of the United States, has been desecrated. This desecration occurring in lands once protected by treaty. The federal government must do all that it can to support Creek Nation's efforts to right this wrong, as well as to support the nation's efforts to protect all sacred sites within its ancestral and treaty lands. Failure to do so calls into question the moral fabric of the United States. We wholeheartedly support the Commission's call for Congress to fully fund existing Indian country programs that aim to rectify the United States' broken promises. Funding, however, is just one part of the problem. As the report's recommendation on data collection wisely acknowledges, accurate data on Native Americans are necessary for federal, state, local, and tribal governments to monitor conditions and make informed policy and spending decisions. If we're truly to have an honest dialogue about rectifying the systemic, continuing, and purposeful violations of the promises in the treaties signed between the tribal nations and the United States, we need to invest in a significant effort to collect and analyze all relevant information on the impacts these broken promises have directly had on issues such as homelessness, psychological trauma, domestic violence, missing and murdered Indigenous women, suicide, and other critical socioeconomic issues in Indian country today. We also need to be prepared to confront the policy implications that could result from this soul searching. The promises that were broken involved the taking of lands, the destruction of sacred sites, the loss of our languages, and the desecration of our trust. Not everything can be restored through funding, and Congress, as well as all citizens of the United States, native and non-native alike, must have the courage to tread where this path may lead us. To be sure, after a full analysis of the costs due to tribal nations,
Mr. Ambassador.
full repayment for all that has been lost due to America's broken promises may prove elusive. At a minimum, however, Congress needs to start that conversation. Modo.
Thank you, Mr. Ambassador. The chair now recognizes Ms. Stacy Bolin, and you, ma'am, you have 5 minutes.
Thank you. Thank you, and good morning to you. Good morning to Ranking Member Cook and to Chairman Grijalva. On behalf of the National Indian Health Board, we're grateful, Chemigwich, for the invitation to testify on the findings of the Broken Promises Report. Anin. My name is Stacy Bolin. I am an enrolled member of the Sault Ste. Marie Tribe of Chippewa Indians in Michigan, and I'm the Chief Executive Officer for the National Indian Health Board. But Mikinek is my native name, which is Turtle Woman, and I've been in Washington, D.C. for 31 years, and my responsibility is to speak the truth for all the people. So that's what I plan to do here today. The findings of the Broken Promises Report have captured the attention of lawmakers, the press, the general public. It has shed over and over again since 2003 a powerful and irrefutable light on the ongoing systemic changes that uniquely impact the challenges that uniquely impact Indian country, from education to public housing to healthcare and beyond. As Native people, we're grateful for the attention that the report continues to bring. The Broken Promises Report covers a wide range of federal Indian policy in addition to healthcare, but nowhere are the consequences of the federal government's abrogation of its treaty obligations more apparent than in the lower life expectancy and the more dire health conditions faced by Native peoples in comparison to the rest of America. Yet for tribes and Native peoples, the findings of Broken Promises don't tell a new story. They don't present a new reality. They affirm the stark reality that Indian country has known firsthand for centuries. One, the federal government has never fully lived up to its legal obligations to tribal nations. Two, the federal government's failure to honor its treaty obligations continues to adversely impact the health of our people. Under the healthcare chapter, the report provides solid evidence of the federal trust responsibility for healthcare for all American Indian and Alaska Native people, and it documents chronic underfunding of the entire system. It provides sobering statistics about our people's health status and the fact that we live sicker and we die younger. And I know that data has been discussed a great deal already this morning. Our written testimony contains a great deal of data and outlines the reality of healthcare systems and status of our people, and we encourage you to read that, please. This report affirms that Congress has yet to fully fund all of the provisions of the Indian Healthcare Improvement Act or the Indian Health Service, or protect the Indian Health Service from dangerous and devastating government shutdowns and endless continuing resolutions, despite Congress giving those protections to the Veterans Health Administration nearly a decade ago. But perhaps the greatest contribution of this report is who made these observations and statements because of who rang the bell. Tribal nations are very adept at speaking the truth about our history, our health status, and our needs. But sometimes it feels like we're only listening to each other. Mark McCarroll, the chairman of the Pechanga Band of San Luciano Indians, said it best. It's like we are shouting in an echo chamber. But when the U.S. Civil Rights Commission takes note of our plight, decision makers like you pay attention. We're grateful that they listened, learned, examined, verified, and reported the truth, our truths, about our health and our health systems. They spoke to how shameful underfunding keeps us sicker, keeps us dying younger, and in constant struggle. But as I said, you're listening, and we're grateful. Now let's make change together. Change is in your hands. We've identified a few policy changes that would result in vastly improved health care for our people, and I'm going to share a few of them with you. Honor the treaties, the trust responsibility, and the government-to-government relationship with the tribes. Respect inherent tribal sovereignty when making policy. Self-determination works. Expand Indian self-determination and self-governance throughout IHS and the entire federal government. Listen to the tribes. Respect our knowledge and culture and traditions. The federal trust responsibility for American Indian and Alaska Native health extends to the entire federal government, not just the Indian Health Service, and budgeting and appropriation should reflect this reality. protect the Indian Healthcare Improvement Act and tribally specific gains in the Affordable Care Act, fully fund the Indian Health Service at level of need as identified by the National Tribal Budget Formulation Work Group, make a long-term sustained commitment and investment in tribal health through infrastructure, capacity, and service improvement. We urge immediate enactment of legislation to achieve advance appropriations for Indian programs, fund the tribes directly. Block grants to the states don't work for us, and funding tribes through competitive grants also don't work for us. I'd like to close with a statement from the Broken Promises Transmittal Letter. The United States expects all nations to live up to their treaty obligations. It should live up to its own. And we're here to help you do that. Miigwech.
Thank you so much. The chair now recognizes Ms. Frances Crever, the Executive Director of the National Council of Urban Indian Health.
Chairman Gallego, Ranking Member Cook, Chairman Grijalva, and distinguished members of the committee, good morning, and thank you for holding this important hearing. My name is Frances Crevier, and I'm a citizen of the Algonquin First Nation with a background in Indian law, and it has been my honor to serve as the Executive Director for the National Council of Urban Indian Health, which represents 41 Title V urban Indian organizations across the nation. UIOs provide high-quality, culturally competent health care to urban Indians, which constitutes more than 78% of Indian country. I appreciate the opportunity to testify before you today as part of the committee's review of the Broken Promises report. My testimony today will focus on the urban Indian component. Urban Indian organizations were formally recognized by Congress in '76 under the first Indian Healthcare Improvement Act to fulfill the government's trust responsibilities to Indians who live off of the reservations. These programs are a critical part of the Indian Health Service, which oversees a three-pronged system for the provision of health care: IHS, tribal programs, and urban Indian organizations, commonly referred to as the ITU system. Due to government policies in line with the Kill the Indian, Save the Man directive, including termination and relocation in the 50s and 60s, the urban Indian story is a sad one. This is not a centuries-old story. One of Nikui's founders is still living today and happens to be one of those children who would run away from the boarding school every chance she got just to be picked up and taken back to her school to endure more trauma. Congress has long recognized the federal government's obligation to provide health care for Native people off of reservations, declaring that the responsibility for the provision of health care arising from treaties and laws that recognize this responsibility as an exchange for the cession of millions of acres of Indian land does not end at the borders of an Indian reservation. Rather, government relocation policies which designated certain urban areas as relocation centers for Indians have in many instances forced Indian people who did not want to leave their reservations to relocate to urban areas, and the responsibility for the provision of health care does follow them there. Data shows that recurring health problems are more acute for natives living in urban areas than any other population in urban areas. Urban Indians have greater mortality rates from chronic disease compared to all other populations, including diabetes, liver disease, tuberculosis, and suicide. You know the statistics, they're not good. UIOs provide services and resources that are critical to addressing these healthcare challenges and have struggled with chronic underfunding, severely limiting the services and patients they serve. To make matters worse, UIOs not only don't receive IHS parity for other things like the Federal Tort Claims Act, 100% FMAP, the IHS VA MOU, but if Congress doesn't explicitly mention them in programmatic language, they are implicitly excluded from participating in such programs. The very issues identified in the Broken Promises report simply cannot be resolved while urban Indian health remains an afterthought instead of a funding priority. A recent GAO report demonstrates that IHS is underfunded at around $4,000 per patient as compared to nearly $11,000 per patient at the VA. And we know for a fact that urban Indian health patients receive even less funding per patient because they receive less than 1% of the IHS budget, but they don't have access to other line items that Rear Admiral Ryaki mentioned earlier, such as facilities, and so our facilities are very outdated. The urban line item at the VA rate would amount to at least $1.8 billion. The current line item is at $51 million. NCUI is grateful that the House passed a $30 million increase this year to the urban line item, which would be a mere 2% of the IHS budget, but the Senate did not do the same. Another example of how UIOs are impacted by the underfunding and lack of parity was very obvious during the shutdown, as several UIOs had to reduce services, lose staff, and close their doors entirely, forcing them to leave their patients without adequate care. In a survey, many programs indicated they could only maintain normal operations for 30 days. One of those facilities that shut down runs 2 UIOs in 2 separate states, and they only received $491 from IHS for mental health funding that year. I did not misspeak. She only receives $491 total for 2 facilities to administer mental health services in 2 states for the year. Lack of funding for IHS, lack of IHS parity for UIOs, and IHS parity for the VA are the culprits here. The Broken Promises report, like many other well-intentioned reports and research, such as the IHS Urban Indian Needs Assessment and the Urban Indian Organization Demonstration Projects, raise awareness of these issues, but without a prompt, true, long-term commitment and subsequent action to address these disparities, like Ranking Member Cook said, a report is only a report and has little impact on the health status of our people. We ask Congress to treat this health system like the only one that you, your children, and your family have. Thank you again for holding this hearing today and working to end the federal government's unfortunate legacy of broken promises to this continent's first people.
Thank the witnesses for their testimonies. Reminding the members of the committee, Rule 3D imposes a 5-minute limit on questions. The chairman will now recognize members for any questions they may wish to ask. I will start by recognizing myself. Ms. Crevier, in your testimony, you discussed the fact that urban Indian organizations have fewer opportunities to access funds than other providers of tribal health care. As a representative of the Phoenix area, I have seen urban Indian organizations in my own district struggle to access sufficient funds. Can you describe some of the ways that urban organizations are forced to try to make up for this funding deficit? Additionally, what are some simple fixes that would make it easier for urban organizations to access resources and provide care?
Thank you for that question. So that program actually specifically, one of the things that they've had to do to make up for the loss of funding is take out a personal loan to help expand their facility because they couldn't get any facilities funding or sanitary funding. They don't, there's programs that have rolled out that Congress has asked us about, like the tribal opioids response that we weren't included in. These are great pitfalls that programs don't have access to, so they have to try to figure it out with the state. And as you know from tribal leaders telling you time and time again, it's not always an easy relationship there. So there's no priority. So they're constantly looking for, there's gaps like the Indian Healthcare Improvement Fund, for instance, because Congress didn't explicitly mention, IHS interpreted that urbans aren't included in that. The IHS VA MOU. Urbans are part of the IHS system. They were created because of the Indian Healthcare Improvement Act, but yet they're still treated as if they're a redheaded stepchild. So that's some of the examples that, so I know that the IHS VA MOU fix is coming, but that's one of the main examples, and it happens time and time again. Even internally in IHS sometimes, they don't even understand that we're not a tribal organization. Tribal organizations are run by tribes, urban Indian organizations are run by nonprofits that are mostly native. So those are some of the issues there. And I apologize, what was your next question?
Oh, it was like, what are some of the simple fixes that would make it easier?
Oh, okay, well, that's a great question. So the Federal Tort Claims Act, that a lot of our programs spend hundreds of thousands of dollars a year trying to cover for malpractice insurance when IHS is already covered, and our community health centers already have that coverage, and in the last 2 Congresses they've tried to extend it for volunteers for the IHS system, but our everyday urban Indian providers do not have that. The 100% FMAP to help cover, to make sure American Indians and Alaska Natives are covered, regardless of what part of the system you're in, the IHS VA MOU, those are some of the very examples that could really help fix this.
Thank you so much. It was very insightful. President Sharp, first of all, congratulations on your election, or condolences. It's a lot of work. Thank you for being here. Yes. We discussed the budget request process in the first panel and how the needs of Indian country have historically and in recent years been ignored. You mentioned NCAI's own budget request process in your testimony. Can you expand on the process NCAI used to come up with the requested levels in the Winds of Change budget request?
Yes, thank you. So we begin by looking all across Indian country at the needs of our communities. When we put together our budgetary requests, we look at every facet of tribal governance, and we have resolutions that go from our region to the National Congress. We also partner with national organizations to tap into the subject matter experts all across Indian country, whether that's housing, education, law enforcement, because the National Congress is that coordinating group, that one place where a unified tribal voice can arrive at making budgetary recommendations. And so we seek to not only connect the ground at the grassroots level from tribal nations explicitly, but also those that have dedicated their careers and their organizations to those subject matter areas so that we can provide the best, most comprehensive, and most effective budgetary proposal requests.
Did you receive any feedback or engagement from the administration after the release of Winds of Change?
Yes. So we need to understand, first of all, the administration's proposals and budgetary requests are not only insufficient, but continue to provide recommendations that propose to drastically cut our budgets at a time when this report not only indicates that we need to increase federal funding, we need to go back to the basic understanding of a lot of the questions that were presented at the last panel, and that is the data collection and gathering. Assuming the administration does that work, it's still just a tip of the iceberg because there's a major disconnect between the agencies and the impacts on the ground. And I'll just give you a quick example. When we faced a 10% reduction at Quinault and Forestry, it looked like $100,000 on paper. That meant we had to lay off a wildlife biologist and a pre-sale forester. We fell 2.5 years behind our annual allowable cut, $12 million lost revenue opportunity. And so even if the administration does the work of fact-finding and data collection, it still misses the target because the impacts on the ground within Indian country is not part of that picture.
Thank you. Now recognize Mr. Hearn.
Thank you, Mr. Chairman. Thank the witnesses for being here and being in Oklahoma. I welcome the Ambassador Chattery here. And you know, you've got quite an impressive resume here, Chairman of the Indian Gaming Commission, which is obviously a big challenge right now of what's going on in Oklahoma, and Chief Justice of the Muscogee Creek Nation Supreme Court. So I'm really thankful for your expertise here today. I'm also thankful for the opportunity to talk about funding shortfalls in Indian country, a topic that greatly resonates with the constituents of my district, which obviously Muscogee Creek Nation has a significant impact to our district. Obviously, by looking at the panel, I'm not Native American, but what I am is an American that believes when you make promises, you should keep them. I think that should be a standard core of who we are in this country, regardless of what your nationality is or where you came from. And as you all know, the current list of unmet needs in this area is staggering and includes the need for infrastructure, numerous essential utilities like electric, water, telecommunication, and roads. And furthermore, there are great gaps in funding for these types of services that are available to tribal lands, including public safety, health care, education, economic development funds. And so for my questions, we all agree on investments are needed in these areas, and I feel that we must support the removal of onerous federal regulations that hamper development rather than simply spending more taxpayer money without fixing these hurdles first. And not only do government regulations and overreach hurt the tribe's ability to obtain the necessary aid, but it also obstructs increased tribal self-sufficiency, and something that we all value. This is also something I'd like to talk to each of you about, and I'd like to start with you, Ambassador Chattery, if you would. Can you talk about some of the burdens and the regulatory processes that you've seen that you're having to constantly battle to try to get back to where we're supposed to be on the funding levels?
Okay, and thank you, Congressman Hearn, and thank you for your leadership in Oklahoma and throughout the country. I'd be happy to. In terms of regulatory burdens, let me just start by saying briefly that the support of tribal self-sufficiency and tribal economic development is an often referenced pillar of federal policy, but it's one that is often not given force or funding in terms of the federal government's actions. And so we see the strides that Muscogee Creek Nation, as well as many other nations, have made in leveraging their modest resources to try to develop sound economic activities, develop economic development, and work with their local and state partners to build a better future for both Creek Nation citizens and their non-citizen partners. But those efforts are often hampered by the regulatory structure under which we operate. My most recent experience is coming from my service as chairman of the National Indian Gaming Commission. At NIGC, we did everything we could to give life to the policy of supporting tribal decision-making, but we had to work within a three-layer system of regulation, federal, state, and tribal. And that was because gaming existed in a world where the states had a regulatory role that otherwise didn't exist. When tribal nations are able to directly engage in economic development and support sound policy without being hampered by state or federal regulations, tribal innovation and regulation really has been proven to flourish. And so generally I'm happy to speak in more specifics, but tribal nations as the local governments on the ground are the closest to the problems and the solutions of their communities, and federal policy should support tribal capacity in developing economic development plans and bringing local solutions to local problems.
Thank you, Ambassador. Secretary Malerba, can you speak to that?
Yes, thank you. I think I'll give you a couple of examples. One is the fact that when you look at how the funding streams are authorized and appropriated, it's a very convoluted system. And a great example is the opioid funding.
As many things in Washington, D.C. are.
Yeah. So a great example is the opioid funding. So Bureau of Indian Affairs, Department of Justice, the IHS, everyone has a little bit of funding, Health and Human Services, SAMHSA. If you could create, a path towards funding just that one issue through one funding mechanism, then we could be more impactful with that. Another is the fact that when we think about, our agencies, they're all operating in silos. Why can't we do some MOUs between the agencies to address those things? And lastly, when we think about grants and the fact that, so much funding comes from grants, there's over 2,000 grants in the federal system that tribes are eligible for. Who could possibly apply for all those, manage them, and then report on them? And as you all know, grants are really not upholding the treaty and trust obligations. So we need to fundamentally change the way we fund the Indian country. This is a trust and treaty obligation. We are different than everyone else in the federal system. And so I would love to comment more, but I can see I'm over my time.
Well, thank you, and I think it's an obligation for all of us on this panel and on the full committee to work on eliminating these barriers so that this promise can be met. I really thank you all for being here, and I yield back.
Thank you, Mr. Hearn. I now recognize Representative Holland.
Thank you so much, Chairman, and thank you so much again for this important hearing. Chief Malerba, my first question is for you. In your testimony, you said SPF advocates for the expansion of self-governance contracting and compacting. I understand that you are part of an effort to expand self-governance at HHS. With respect to the feasibility study and discussions associated with that effort, why did that effort fail? Or stall, I should say.
Well, thank you, Congresswoman. So that is a little bit of a touchy issue with me because I spent a lot of time working on the report. And I think the effort failed just because of what we were talking about, regulatory barriers. And so HHS did not seem to be able to find a way to address some of the flexibilities we would need to create self-governance within HHS due to the grant-like nature of its funding. So it goes directly to the heart of that. And one example of that was the fact that we wanted to do self-governance for early childhood development and Head Start. Well, if you are participating in both of those programs, you can't even share a playground together. You can't fund that playground for the same age children. So I think that when we think about self-governance within HHS and all of the other agencies, we need to think about ways that we can streamline it and listen to the tribes who are operating the programs. They're the ones that know best how to serve their people. And even prior to being chief chief, I was the Health and Human Services Director for a tribe, which meant let's look at the umbrella and let's coordinate within the tribe to provide services to our people, because these issues don't operate in isolation. We all know this. We're human beings. There are many multifactorial approaches to addressing the needs of your people. And so we just need to think about how we can do this differently in the future.
Thank you, thank you. Last question for you, Chief Malerba. Your testimony speaks to a number of reforms to OMB. Why are these necessary, and how are tribal nations currently working with OMB?
Well, OMB has a less than transparent process, and we want to make sure that as we think about OMB, that we have a tribal advocate within that office, because we know that if we look at the policies that are being promulgated and we look at the budgets that are being proposed, they are sadly lacking and they don't reflect the needs of Indian country. We need OMB to recognize that our needs are different, that our funding should be mandatory, and we should have accurate data around what those funding needs are, and we don't believe that OMB has that. And it is very sad when we know that. So for instance, there is $50 billion of infrastructure needs noted in the National Congress of American Indians report lacking, and yet we're not even asking for full funding for our budgets. That's a problem for us. Thank you.
Thank you so much. My next question is for Ms. Bolin. And thank you so much for being here, and NIHB's work in helping Senator Warren's office and mine on recommendations for our Honoring Promises to Native Nations Act. Thank you. We appreciate all of your professionalism and information. Should Congress consider fully funding IHS, or does NIHB believe other vehicles are better options for delivering health care, like a Medicare, Medicaid type program?
Thank you for the question. The National Indian Health Board believes that the Indian Health Service should be fully funded at level of need funding. And I'd like to point out something that your question triggered. On page 69 of the Broken Promises report, there is a trend in Indian Health Service budget and appropriations. And included in this as an overall mark for what IHS receives are all of the third-party billings and collections like Medicare, Medicaid, private insurance, VA, et cetera. The Indian Healthcare Improvement Act forbids those from being used as a baseline for the funding that the Indian Health Service receives, because the tribes are working overtime to bring those dollars in, and the trust responsibility extends to the entire system. So the question you asked said, should we move to something like a Medicare, Medicaid model? The model works collaboratively the way it is now, and if the Indian Health Service were appropriately funded at level of need funding, it would be functional, in our estimation.
Thank you so much. Thank you. Thank you. My next question is for President Sharp, and yes, of course, congratulations again, and I just always want to thank you so much for your strong stance on climate change. I appreciate that very much. Thank you for taking the time to testify today. Your testimony states that the federal government has continued to fall short of meeting its treaty obligations, not only through underfunding, but by sequestration cuts, government shutdowns, and other factors. How has this affected the ability for tribes to provide for their people?
Yes, I appreciate that question. Thank you so much. I think we need to look at a foundational issue, and that is an issue that was mentioned in Chief Malerba's testimony about consent. We advocate for achieving political equality with the United States. That is a fundamental basic civil right that countries outside of the United States recognize in the UN Declaration on the Rights of Indigenous Peoples. Because if we cannot make decisions independently and routinely go through an exercise of checking a box in a consultation process, and other governments can take unilateral action affecting our land, territories, and resources, we are still trying to effectively manage our people and our lands. That, first and foremost, is an issue that must be addressed, because until we address that foundational issue, we're going to continue to see these symptoms of a much deeper problem in Indian country. And so having sustained funding and predictable funding would definitely help in the long-range planning. Right now, we don't have that ability when we go year from year, not knowing if we're going to even achieve the basic minimum foundations of funding. And year after year, we're finding that funding is cut. And year after year, we're increasing our budgets through for-profit entities to subsidize the federal trust. At Quinault, we subsidize to the extent of $6 million the federal trust responsibility. So until we address those foundational and core challenges, we're going to continue to see that gap widen.
Recognize Chairman Grijalva.
Thank you, Mr. Chairman. It's a question for two of our witnesses, Chief Malherbe and President Sharp. In the discussion today, we've talked about data collection, underfunding, access to the decisions early and not after the fact. We've talked about all those things that would improve the bad situation. But I think a statement that was just made provoked this question is that it's a symptom of. And I think, to get back to the earlier point that all of you have made, and it's open to all of you, the question, is the issue of the constitutional responsibility that Congress and the country and its government has toward indigenous people and Native nations and specifically in this instance. And that issue is the one about not only consultation, but an agreement to be a partner in the future of Native people in this country. And that partnership has been one-sided. And as a consequence, we go through the litany of things that we can't seem to erase. So my question is, I think going forward, there's this, the legislation that Representative Holland spoke to as an important piece of legislation that looks at empowerment and accountability and self-determination is key to the sovereignty question and key to the trust responsibility question. The issue of codifying what consultation means and the rules that rules of engagement for everyone, particularly federal agencies across the board. And the other issue is advanced appropriations, that is locked in and that the threat is minimal to those funding. But let's talk about empowerment. Let's talk about the issue of sovereignty and how this all ties into the issues you brought up about sacred sites, the issues that were brought up about, whether you're at Standing Rock or somewhere else, decisions being made that impact your people and the land, and yet have no role in those decisions. And I think that part of what's going on in Indian country, to me, and I think it's a very exciting time, is the redefining of what sovereignty means, and in relationship to the trust responsibility we have to Indian country. So if you could talk about the role that sovereignty and this empowerment issue that I'm mentioning without really defining for you, because I can't at this point, because I think much of that definition has to come from Indian country. But if you could respond to that, and it's open to all of you, but let me begin with the President and the Chief, if I may, and then go down.
Thank you. I really appreciate that question. You're absolutely right that to truly solve this crisis, we have to come together government to government at a very high level. But before we come to the table, I think the United States has some serious and significant homework to do, and that is to truly understand this crisis. As we mentioned, the report uncovers a great deal of that, but there's still a lack of knowledge all across federal agencies. All across federal agencies, they do not understand their trust responsibility. That has to be done to pinpoint the extent by which the United States is failing that obligation. Once the United States does that work, then I think we could sit down in a bilateral fashion to understand the solutions. We have a very clear vision for how we go from where we are today in impoverished conditions to a path of prosperity. But in that path, there are multiple barriers that you mentioned that are policy, whether it's economic policy, tax policy, sovereignty. So once that work is done, I think we need to engage in a nation rebuilding exercise, much like a Marshall Plan, and engage tribal nations to understand our vision, our policies, our recommendations, because if the United States, in the face of this crisis, chooses not to fully fund us, the decision does not end there. There's still work that has to be done to close that gap, and we have some excellent recommendations and ideas.
Chief?
So thank you for your question, and thank you for being here today. One of the things that I want to make note of, the fact is that as the United States was formulated, the tribes in the East had diplomatic relations with the crowns of Europe. It wasn't with the United States because we predated the United States. And I also want to make mention of the fact that, you know, we talk a lot about the cession of lands and we talk about the cession of mineral rights. What about the genocide that happened here that went right across the country? We lost 90% of our population, and as it moved to California, I understand that, you know, hundreds of thousands of people were lost during the gold rush. So as we think about sovereignty and we think about the United States keeping its promises, we need to have that bilateral relationship, but we also need to educate everyone and stop having to re-educate everyone. 93% of our students are not in BIE schools. They are not hearing about how this country was formulated. They're not hearing about their history. I grew up in Uncasville. I went to a school called Mohegan School, which was on former Mohegan territory, and yet I was singing songs about Christopher Columbus in second grade, right? So we need to do better at how we educate not everyone throughout this country, because then people can truly understand what that relationship is supposed to be. And so I appreciate your question, and I think education is one thing, but actually having the respect for tribal nations that we deserve is long overdue.
You're back.
Thank you, Chairman Grijalva. I thank both our panels for their insightful testimony and the members for their questions. The members of the committee may have some additional questions for the witnesses, and we will ask you to respond to those in writing. Under Committee Rule 3.0, members of the committee must submit witness questions within 3 business days following the hearing, and the hearing record will be held open for 10 business days for these responses. If there is no further business, without objection, the committee stands adjourned.
So nice to see you. Our paths cross regularly.
I hope so too.
We were just, as I said, over the moon.
I just missed the USEP 50th anniversary.
I know, we were so disappointed that you
I
couldn't
was thinking
come.
if I would have been able to recalibrate my calendar.
I know,
was
but
just
it's so
focused-
hard to do.
I was focused on the election, and I didn't even plan the what if I win sort of scenario.
Right.
So I'm telling you, for the first 2 weeks, the idea of getting a regular night's sleep, I woke up that Monday at 1:30 ready to go to work. I was just, and so it took a good 2 weeks just to get a full night's rest.
Oh, I know, exactly.
Thank you, brother. Thank you.
Yeah, I'm looking good.
You are.
Yeah, well, Chairman hired me in, so it's great.
Well, anything I can do to help, as always. Just keep looping me in. And
Yeah, he'll be here tomorrow.
Okay.
He's coming in tomorrow.
Okay.
Yeah.
How long are you here? Through Wednesday.
Till Wednesday?
Yep.
Well, maybe we could, do you have your card on you?
Yeah.
Maybe we could,
Let's see. Let me
meet
give
up
you
or
this.
something.
Yeah, that would be great. I'll show you the office.
Yeah.
Yeah, give me a call. I'll be around. Okay?
Sweet. All right. Okay,
Maybe
good.
even tonight.
Yeah.
Okay.
Great to see you again, brother.
Okay.
Stay strong, keep that fire going.
Thank you.
Appreciate it, but name is Ileana, and she was born, I think, September 20th, and I think she was due November 6th, so it's not like, I don't know.
It's still, I mean, so that's what, like 9 weeks?
Yeah. So, just, but she was like 6 pounds, 6 pounds, 8 ounces born, so she was still real big. And so, yeah, so, anyway, when I saw that, or when I heard, like, my brother was like, oh, I think the baby's born, I'm like,
Now? Oh, wait, wow. That was the question that I got to ask of the doctor. You mean now?
So anyways, that was crazy, but it's so glad that they, there's my St. Paul, Minnesota.
Oh, man.
He's a police police officer, and she is a social worker. So, Carla Lott, what's going on?
How's it going, Jake?
Oh, it's going.
Passamaquoddy Indian Township gave these to me. So I can only assume they're from me.
I wore my black beat moccasins on Rock Your Mocks Day.